Okay, chapter 5 is called Development at Different Ages. So it's going to focus on birth to 2 years old. A lot of changes between birth and two, so they break it down into like almost every 3 months or so. These are a bunch of the key vocabulary words, but we'll get to them in the chapter. Okay, so people grow pretty much until they're like 20, but the most growth they do is in the first 2 years of their life. And then it slows down a little when they reach 3. They change their activities, their diet, their sleep schedules, all of that stuff changes as they begin to grow. There's something called sudden infant death syndrome. It's called SIDS. It's when babies, for no good reason, die during their sleep. Some people think that they may overheat themselves, or it's almost like they're so young that their brain forgets to keep breathing. So to prevent that, you want to put them on their back, have a firm sleeping surface so they can't like smother themselves in the bedding. Don't have too many comforters, pillows, anything that they could suffocate themselves with, and don't want to have it be too hot. They can overheat as well. As they grow, they'll be able to start doing some things, rolling over and lifting their heads. These are all part of what are called gross motor skills. It begins with the head and the chest. They first get control of their head, or they try to. That's why their head's always wobbling around. And then it moves downward through their body, from their spinal cord, through the rest of their body. First 5 months, they learn to lift their heads, move their head side to side, and cycle their arms and legs around. At about 4 to 6 months, they'll learn to roll over. Now, you don't have to memorize all of these. This will just help pass the test. These are things that you should sort of kind of know. Like, hopefully you know that that doesn't happen at the age of 10, but don't get too crazy trying to memorize all this. 6 to 9, they start sitting up on their own. So you can see they went from rolling over, now they're starting to sit up on their own. Crawling is when they move across the floor while their belly is still on the ground. Creeping is when they can get up on their hands and knees and kind of scoot around, but their belly's not on the ground. So those are two important words. They learn how to creep after they do what's called hitching. They can slide on their bottom using their feet and hands to push themselves, almost like sliding on their backs. They start to learn to stand around 9 to 12 months. Finally, they can take their first steps, usually right around a year. And once they can walk around on their own, that's when we officially call them toddlers. I put a chart in there of like the stages of how that goes. Unfortunately, the reason they look like drunken sailors all the time is most of the weight is centered in their head when they're young. 70% of the weight of an infant at birth is in the head and the chest. On average, they're 20 inches long, and they can increase 10 to 12 inches within the first year, so then they're about 30 inches. By the time they turn 2, they'll be like 36 inches long. Going back to birth, an average baby birth is 7.5 pounds, but then by the time they reach 5-6 months, it will triple. So they'll be like 25 to 30 pounds. And by age 2, they'll weigh 4 times as much. It's like 35 pounds. I put a chart in here for different activities and when they start to stop, like sucking on things all the time, or all these different skills that they have. So you can just look at the chart. As far as their brain goes, during the first couple months, they develop their vision and hearing capabilities. So at first they can't really see. Their vision is very blurry when they're born. They'll start to focus on things. Their eyes will slowly develop, and then it's best for them to have things like patterns to look at. That's why people like paint patterns on the wall or put things, bold colors, faces. You want to stimulate their eyes so that they can grow as much as possible. 3 to 6 months, they'll start to notice their surrounding environment, which is like familiar faces and objects. They'll start to make more and more noise, obviously. 6 to 9 months, they develop what's called object permanence. That means like when they're real young, they only think that something exists when they're holding it. But then imagine you had the bottle and then you put it behind them. They know that it still exists. Like that's something where it seems obvious, but little kids, like babies, don't really know that. Somewhere around 9-10 months, they might begin to recognize their own name, probably because you say it all the time. Some people believe you should teach them some beginner baby sign language. It's basically modified, simpler versions of the American Sign Language. Evidence shows that this helps them to learn to speak. It's like a form of communication, so a lot of times they learn to speak and have better vocabulary than other kids if they're taught these hand gestures. Between 9 and 12, they're constantly reaching for items you place out of their reach. That's because they're starting to like expand their boundaries. They'll continue to talk more and more. Between 12 and 18 months, they'll start to have language skills. They'll start saying sounds or mimicking sounds. They'll often use these things called hollow phrases, which is a single word combined with a gesture to express a full idea. It's almost like they can't verbalize what they're saying, but they're trying to help you, so they'll make some kind of sound and some kind of emotion. 18 to 24 is when they start actually solving their little problems or activities by referring to something they did before. They start engaging in something called deferred imitation. Means like they watch other people do things and then they imitate them. Still around 2, they'll start to explore more, but they don't know that danger exists. So like that's why you have to be really careful of like dangling strings, plastic bags, exposed outlets. They just have no concept of danger. Social emotional development means like their ability to like communicate and have feelings. The first couple of months they have some emotions, but then as they get older, like 9 months to a year, they'll start to have actual like fear, anxiety, anger, pleasure. It's when you start to notice that they are more aware of their environment. They begin to understand their own emotions, and apparently their emotional expression increases. Like you can kind of read their face of what they want, even though they can't talk. Every kid has a unique temperament. That means every kid is different. It's important for people that work with them to understand that kids are different, and that when they act differently, you shouldn't take it personal. One of the key things is that there's as much consistency. That's why even to this day, like 7 o'clock, Charlie walks into the bathroom. 7:05, she goes in the tub. 8 o'clock, she eats this. Like, that's what they've been brainwashed, and it really does work to get your kid on a schedule with consistency. Kids that have trouble are the ones that have inconsistent caregivers, and that can actually affect them long term. It gives them anxiety and insecurity, even though you can't tell yet. It'll just show up later. Separation anxiety is when they're upset about being separated from whoever they're used to being around. That starts at 6 months, and then it gets worse around 15 months, which is why they get upset when they get dropped off at daycare. Between 9 and 18 months, they can have the hardest time at drop-off. Basically, the skill is let parents know it's kind of normal, and let the kid know that they're loved, and to remember yourself. It has nothing to do with you. It's not that they don't love you. It's that they're just feeling a little bit abandoned. As a teacher, you want to watch out for something when kids are what's called failure to thrive. It means they're not being successful. Um, Sometimes it's because they're not being fed properly or they're being neglected, but other times it's because their families are really poor and have lots of other problems which are affecting the child. All that stuff really affects a kid. That would be determined not by you. It might be recommended by a caregiver, but specialists would make the determination if the kid is having failure to thrive, and then they can see what they can do to help so that it's not a permanent problem. It is a child care professional's responsibility to report that, probably just to your boss at first, and then they would alert the authorities to have somebody come out and maybe interview the parents to make sure the kid is receiving at least decent care. As they approach the 6-month mark, they'll be able to respond to their caregiver's actions, notice their baby's emotions, and use different types of cries. So the kids just slowly develop a better ability to communicate. By the time they turn 1, they'll be able to do active communication. They will imitate their caregivers, and this is called joint attention, when they pay attention to the same thing as their caregiver. So like whatever they're doing, like the kid will begin to focus in on that. They will be able to express more emotions. That's why they get upset when their parents leave them. Finally, between 1 and 2, a couple things will happen. They'll start to realize that it's not just the here and now. There's like the past and the future. They start to become aware of that. They start to notice other little kids, and they learn the word no. And it says they sometimes even say no when they mean yes. So it's just like they develop a little bit of autonomy, and then they kind of become little tyrants. And that's why they call it the terrible twos. I also made another version of this PowerPoint that has every other slide. It has blanks in it so you can practice to see if you picked up the information.